Unfortunately, we are still a very small percentage of the dermatologists in America, so it can be difficult for patients seeking a dermatologist with skin of color or with a knowledge of skin of color to find that match. But we have great resources.
I think it's important for patients to do maybe a little legwork and research before they decide what doctor they're going to see. There are some resources that patients can use, including resources from the Skin of Color Society and the American Academy of Dermatology.
Patients could look on websites such as the Skin of Color Society, where we have a database called Find a Doctor, and there you can find a dermatologist with expertise in skin of color who may be near you, and you may be able to visit them.
You look online, you ask friends for referrals, you may even ask your primary care doctor. Keep an open mind with the names that they present to you. There are definitely colleagues who do not have brown skin, who are true experts in skin of color because of their training and their experience.
So board-certified dermatologists obviously have a significant amount of training. Undergraduate degree, a medical school training for 4 years, an internship, dermatology residency, and oftentimes fellowship training. So the degree and the path that your doctor takes is very important because they need to have those training experiences to be able to offer you a lot of options, to manage you correctly, to have seen the disease and all types of skin tones and skin types.
I think one of the great indicators of a dermatologist's area of interest is if that dermatologist happens to publish their work in the peer-reviewed literature. That gives one great insights into what they are passionate about and have unique expertise in.
Certain doctors do research and they publish in certain skin conditions, and that means they're an expert in that condition. Especially if you have a condition that's challenging, it might be worthwhile looking and seeking that doctor out specifically.
It's a simple matter of asking the dermatologist, do you have experience on my skin? Sometimes you go in and you're shown photographs, befores and after. Well, are there photographs of people who look like you?
I think patients have to be advocates of their own health and have those lines of communication with your physician so that you can have that dialogue, specifically asking, do you have experience treating patients who look like me? Do you have experience treating patients with my condition? Do you have good results in treating patients like me?
You have to decide, is this physician listening to me? Does this physician understand what I'm saying? And is this physician able to make the right diagnosis and give me a treatment that we agree? It's a partnership.
We build our physician-patient relationships over time. And while you may not get every single thing answered on the first visit, it's important to understand, is my dermatologist listening to me? Is my dermatologist going to be a great advocate? Is my dermatologist going to explain things to me in a way that I can understand the specific conditions that I have? So it's always important to ask these questions so that way you can enter into a partnership with your dermatologist.